Landmark Trials for the Management of Diverticulitis. Welcome to today's deep dive into the evolving management of diverticulitis. Over recent years, major clinical trials have dramatically shifted our approach, steering us away from aggressive interventions and toward evidence-based, patient-centered care. Let us explore these landmark studies and how they have transformed our decision-making in treating diverticulitis. First, let us address the role of antibiotics in uncomplicated diverticulitis. Traditionally, antibiotics were prescribed for most patients, but pivotal trials have challenged this routine. The Antibiotics in Uncomplicated Diverticulitis trial, published in the Journal of the American Medical Association in 2012, asked whether withholding antibiotics is as safe as administering them for acute, uncomplicated diverticulitis. In this multi-center, randomized, controlled trial from Sweden, patients with computed tomography-confirmed uncomplicated diverticulitis were assigned to receive either intravenous antibiotics or observational management without antibiotics. The results were striking. There was no significant difference in recovery time, complication rates, or recurrence rates between the two groups. Furthermore, patients in the observational group enjoyed a shorter hospital stay. This trial provided compelling evidence that, for select patients, antibiotics can be safely omitted, paving the way for outpatient management. Building on this, the Diabolo trial, published in the British Medical Journal in 2017, further challenged the necessity of antibiotics in uncomplicated diverticulitis, this time in a primary care setting in the Netherlands. In this pragmatic, randomized, open-label trial, patients with imaging-confirmed uncomplicated diverticulitis were randomized to receive supportive care without antibiotics or traditional antibiotic treatment. Again, the results showed that omitting antibiotics was not inferior to using them. Complication and recurrence rates were similar, and the time to recovery was actually faster in the group that did not receive antibiotics. This trial reinforced the findings of the Antibiotics in Uncomplicated Diverticulitis study, solidifying observational management as a viable option for uncomplicated cases. Next, we turn to the question of elective surgery for recurrent uncomplicated diverticulitis. For decades, the standard advice was to recommend surgery after a second episode to prevent further complications. However, this practice has come under scrutiny. The Diverticulitis Recurrence or Treatment Trial, published in the New England Journal of Medicine in 2024, investigated whether elective surgery offers superior quality of life compared to conservative management for patients with recurrent, complicated, or persistently painful diverticulitis. In this multi-center, randomized, controlled trial conducted in the Netherlands and the United States, patients were assigned to either elective surgery or conservative management. The findings were revealing. Elective surgery did not result in a statistically significant improvement in quality of life over conservative management after 2 years. Although recurrence was more common in the conservative management group, most recurrences were uncomplicated and manageable without emergency surgery. This trial marked a major shift, suggesting that elective surgery is not mandatory for most patients with recurrent uncomplicated diverticulitis. Instead, the decision should be individualized, based on patient preference and symptom burden. Moving on to the management of acute complicated diverticulitis, particularly in cases associated with an abscess, percutaneous drainage has become an important strategy to avoid emergency surgery. Let us discuss the laparoscopic lavage versus drainage for diverticulitis study, published in JAMA Surgery in 2019, with earlier results in the New England Journal of Medicine and Annals of Surgery. This multi-center, randomized clinical trial focused on patients with perforated diverticulitis and purulent peritonitis, classified as Hinchey Stage 3. The trial compared laparoscopic lavage to the traditional Hartmann's procedure, which involves resection with colostomy. Initially, there was hope that laparoscopic lavage would be a safe, less invasive alternative. However, later results showed a higher rate of serious adverse events in the laparoscopic lavage group, and long-term outcomes did not favor this approach. Laparoscopic lavage did not reduce the need for a permanent stoma and was not superior to the traditional resection. As a result, resection, either with primary anastomosis or Hartmann's procedure, remains the standard of care for generalized peritonitis, while percutaneous drainage is preferred for well-contained abscesses, classified as Hinchey Stage 1 or 2. Finally, let us consider the surgical approach for elective cases. The transition to minimally invasive techniques has played a pivotal role in elective diverticulitis surgery. The Sigma trial, published in Annals of Surgery in 2005, asked whether laparoscopic sigmoid resection is superior to open surgery for symptomatic diverticular disease. In this multicenter, randomized, controlled trial, laparoscopic surgery led to better short-term outcomes, less blood loss, quicker bowel function recovery, shorter hospital stay, and reduced need for pain medication, while long-term outcomes, such as recurrence and quality of life, were similar to open surgery. This firmly established laparoscopic sigmoid colectomy as the preferred approach for elective surgery when feasible and performed by experienced surgeons. To summarize, these landmark trials have revolutionized the management of diverticulitis. Today, outpatient management and selective use of antibiotics are standard for uncomplicated cases. Elective surgery is no longer automatic after the second episode, and decisions are tailored to each patient. For complicated cases, percutaneous drainage is prioritized for localized abscesses, and resection remains standard for generalized peritonitis. Laparoscopic approaches are preferred for elective surgery due to their improved recovery profiles. The overarching principle is a shift toward individualized, evidence-based, and less invasive care, ensuring patients receive treatments that are both effective and aligned with their preferences. That's it. Thanks for tuning into today's episode. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.